Not too long ago, it felt good to withdraw your cash from the bank, didn't it? For a vacation or a new car. But today, withdrawing your own cash has become risky. Pat Boone here for Swiss America. According to The Secret War, a new Swiss America white paper, I learned that all banks are now required to spy on you and me for the government, and then report any financial behavior deemed suspicious or unusual. You must read The Secret War. It's free. Truth is, I believe the government's new war against cash is really a war against us all. But the secret is now out. So please, get and read The Secret War.
Pick up your phone and call right now. 800-932-5517. 800-932-5517. Once again, that's 800-932-5517.
Well, welcome aboard to Elevating with Marcia Hawkins here on the Sports Byline Broadcast Network. As we talk her world and your world as well on the Sports Byline Broadcast Network, Sirius XM 211 tuned in, also the iHeart Radio app and American Forces Radio Network as well. Well, most people like to take the weekend off, and you work as hard as anybody on the weekends, huh?
Hey, why not? Love to work. And welcome everybody back to the program. Glad to be here in week 2 of our program. Very excited. Got a lot on tap for today's show and looking forward to getting it started.
Yeah, indeed. And we're presented by myhealth-quotes.com. myhealth-quotes.com. I hope I have that right.
You do. Life and health insurance and ancillary products like vision and dental. And we're going to delve a little bit into that in the program today. With everything that's going on in the country, in the world, I really want to talk a little bit about that and how, how important it is to everybody in their life.
Yeah, you know what's important? Tom Brady can't leave New England without taking a shot. I don't know why he did this. He really did. He took a shot, standing there with Gronk. He says, hey, football's fun again. He looks bitter and he looks petty. I mean, it's just shocking to me.
Are you going to bring this up every week?
Every single week until football starts.
Oh, yeah, I know. Hey, do you think the football season's going to happen?
Well, you said it would last week, so I'm going with what you said.
I'm asking you. I believe it is going to go off. I don't know. I'm a little concerned. I wonder if he has buyer's remorse. I wonder if he really is second guessing himself on, leaving New England and not retiring a Patriot. Although I do believe he will come back and sign for a day and retire. But yeah, it's a little puzzling. He's probably one of the most disciplined people I've ever seen in life, let alone sports. And yet he does seem to be kind of kicking that to the curb lately.
Yeah, he should be bigger than this. And I know he's wanted the opportunity to be Bird or Yaz or Ted Williams and be a great legendary Boston sports figure. But we'll delve into that maybe later on in the program. MyHealth-Quotes.com, title sponsor of Elevating with Marcia Hawkins. We look forward to it. Fans in the ballpark. Minnesota Twins say they want fans in the ballpark. The Red Sox want fans in the ballpark. Summer tourism looks good. Marcia has got her finger on the pulse of that and a whole lot more. We look forward to it. MyHealth-Quotes.com for your insurance. Check it out. We come back. The weekend edition, Elevating with Marcia Hawkins on the Sports Byline Broadcast Network. Between jobs, retiring, or just need health or life insurance, please visit myhealth-quotes.com or call 833-687-5261. Before you try to get a quote online, call us. We will provide you with the information most sites will not. We teach you exactly what life or health insurance plan you qualify for, how to use your plan, and maximize your benefits. We provide you with the information to make a knowledge-based decision to ensure selecting the right plan. myhealth-quotes.com to schedule an appointment.
Attention to anyone that's written a book or wants to write a book. The process is not that complicated. Take a first step. Even if you write a page a day, you'll build momentum and your book will become a reality. The hard part is getting it published. That's when you need to call Page Publishing. They've got hundreds and hundreds of thank yous from different new authors, just like you. They make the process of publishing your new book and getting it sold online a simple process. You can learn how simple it is right now by calling for your free Page Publishing New Author Submission Kit. One quick 3-minute phone call, that's all it takes to get free information and learn how you can get your book published. Pick up your phone right now and call us 24 hours a day at this number. 800-603-0885. 800-603-0885. 800-603-0885. That's 800-603-0885.
Hey travelers, do you want to save money on your next flight? Then pick up the phone and call. That's right, call, because the best prices are not online. They're with SmartFares. See, SmartFares has special deals with the airlines. When they have unsold seats, they use SmartFares to fill them. So you get airline tickets at ridiculously low prices. Our prices are too low to publish online. With the extra money you'll save, you can book another trip or treat yourself to dinner or shopping. So stop searching all of those travel sites to find the lowest price on your next flight. Let one of our SmartFares expert travel agents find ridiculously low prices for you. Call SmartFares today and get the best price on your next flight. Guaranteed. Also, save up to 50% off business and first class tickets.
855-325-1780. 855-325-1780. That's 855-325-1780.
O'Reilly. Get your car ready for summer at O'Reilly Auto Parts. Oil? Check. Battery? Check. Wipers? Check. And don't forget your cooling system. Right now, get Peak Long Life Universal Pre-Mixed Antifreeze and Coolant for $12.99 a gallon at O'Reilly Auto Parts and earn double O Rewards points with your purchase. Stop by O'Reilly Auto Parts.
O'Reilly Auto Parts.
All right, welcome back. Sports Byline Broadcast Network. It's Elevating with Marcia Hawkins, presented by myhealth-quotes.com. Well, we'll talk about the summer tourism season, ballparks. Will there be fans? Will there not be fans? There's talk of as little as 8,000 fans being allowed in some of the ballparks. We'll get into that. Summer vacation numbers are spiking upwards, and we're going to forecast July 4th for you people all across the country, including the Northeast, Long Island, Cape Cod, all the way down to Virginia Beach and Ocean City, Maryland. We'll get into that. But, Marcia, lots to get to. But, in these times, I don't like saying the words, but in these times, everything seems to be a moving target, including people's jobs, their benefits, and their insurance.
Absolutely. So it really comes down to, at myhealth-quotes.com, we get quite a few inquiries from people who have been laid off. The options that are available to people when they lose their job is a program that actually President Clinton enacted, which is the COBRA program, which allows you to bridge your health insurance for your family and yourself until you either get another job. It runs for 18 months. Another option that most people have that they don't realize is they can also, if they sign up for their COBRA during what's called special enrollment period, that's outside of open enrollment period, they will not be able to apply for the Affordable Care Act. However, if they decline their COBRA in most cases is very expensive. They usually guarantee the premium for I think it's 4 to 6 months. It varies by company, but then after that, the prices can go way up. COBRA tends to be a lot more expensive than the Affordable Care Act because the Affordable Care Act, most people know it as Obamacare, is solely based off your income. If you fall within the income guidelines, you will receive a federal premium tax credit to help with your premiums. So for some people, it's a great program. But if you do, a lot of people want to wait and see what they're going to get with their COBRA and then kind of stack it up against the Affordable Care Act. So those are two of the options that are immediately available to someone who's lost their job. The other option that they have is there's some faith-based health share programs out there that they can look at, and also private insurance. And I want to talk a little bit about that because there is a huge fundamental difference between all of those programs. So I'm going to talk a little bit about that first. So on the Affordable Care Act, it is based off your income. If you are over the income guidelines, you will most likely pay full price. What people, fail to understand is, we get calls all the time from people who talk about, the pre-existing conditions. There was so much in the news several years back when President Obama was in office about Obamacare and pre-existing conditions going away. That is true. You will never answer a health question when you apply through like healthcare.gov, so to speak. That said, your pre-existing conditions are covered, but the Affordable Care Act premiums tend to be a little bit more expensive. They also tend to be restrictive, meaning they're most likely you're able to use them in your network. Most of them are HMOs, health maintenance organizations. Yeah. So you're able to use them in your state most likely, unless you're in an emergency situation. In most cases, it will cover for that circumstance. But you're also in a risk pool of people who have pre-existing conditions. You're offered the 10 essential benefits with the Affordable Care Act, which is maternity, prescription drug coverage, mental health, pre-existing conditions, newborn care, maternity, all of that. So you get the 10 essential benefits with that. But you are in a risk pool with people who are, 60 years old, possibly with stage 5 lung cancer. So if you're young and healthy, it tends to be very expensive for people who do not, necessarily use all of those benefits. If you are a 60-year-old woman and you're never going to have any more children, obviously, then you're paying for maternity, even though you may not use that. So the Affordable Care Act is wonderful for people, but it's not for everybody either. COBRA is basically an extension of your healthcare plan through your employer. Again, it runs for 18 months. Most health plans that you get through your employer do cover pre-existing conditions as well. But if you are not offered health insurance through your job, you are also eligible to apply for the Affordable Care Act as well. So open enrollment runs in most states November 1st through December 15th. So you have roughly 6 weeks to apply for your health care coverage. It always begins on January 1st of the following year. So open enrollment will start November 1st this year, and your premiums and your plan will start on January 1st. So if that's a little noisy for most people, and it can be, especially for people of the higher income, and you're healthy, you also have the option of going the private insurance route, which it can be a great plan for most people. However, they will never cover maternity. They will not, in most cases, a lot of them do not cover prescription drug coverage, but it is cheaper. They tend to be EPOs or PPOs, which is a preferred provider organization or an exclusive provider organization, and PPOs are really the best plans out there. But you have a lot more flexibility. Your premiums are based on the insurance that you're actually going to use. So it tends to be cheaper, less restrictive. A couple of the plans out there that we offer at myhealthquotes-.com, you're able to use them pretty much anywhere in the country as long as it's in network. The networks tend to be a lot higher. There's, I think, the multi-plan. United Healthcare has a couple of provider networks as well. So those are really, really good plans. Another thing that you're going to want to think about when you're looking at private insurance is you want to look at the duration. Each state regulates that. With Obamacare came a lot of regulation with insurance. In some cases, a lot of the carriers have actually pulled out of some states. So some states have very lean coverage, and and unfortunately, it limits the options for people in that state. So, but the good news is, in some of the states there's one plan out there that's offered up to 3 years. So the significance of that is, if you were, say, going to be out of work for 6 months and you realize the savings of having private insurance and you want to keep it a little bit longer than that, you always want to go with the longest duration. And the significance of that is that if you were to purchase a 6-month plan and on the last day of coverage, even if you repurchased another 6 months and you all of a sudden fall down the stairs and, break your leg, and the doctor says, well, unfortunately, you've got, a lot of swelling. I can't operate for, a couple of days. even if you had signed up for another policy, that pre-existing condition would not be covered in term 2. So it's always a couple of cardinal rules with buying health insurance. It's not a one-size-fits-all. Thinking that you can just go on the internet, purchase a plan without talking to a licensed agent is not recommended in those scenarios that I just laid out. The last thing you want to do is find out that your doctor tells you you're pre-diabetic, and you're thinking that you're not diabetic. Well, if you're deemed pre-diabetic and you've been prescribed medication, you're diabetic, and God forbid you have a heart attack, and they relate that back to your pre-diabetes or your diabetes, they will deny the claim. So it's always good to know what your benefits are, specifically what's covered under your plan. Always go for the longest duration, and make sure that you have all your bases covered, and make sure you understand the significance of each and every part of the plan, so that you don't purchase something and then find out the benefits and the coverage is not there.
Yeah, and we're reaching a huge audience here, truly. And in fact, you represented at least one, maybe a couple of XFL players, professional athletes, and gig workers out there. So we'll delve into this a little bit later on in the program. But man, that's good information, and it's true. People get online, they make big mistakes, and they're expensive mistakes. That's the problem. So we will delve into that. Again, the website?
myhealth-quotes.com.
Yeah. myhealth-quotes.com. Lots to get to. Brady takes a shot at the Patriots. Baseball is going to play 60 games this year. NBA in a bubble in Orlando. NFL and college football very much hanging in the balance. The sports world very much in peril. We'll delve into that. It's Elevating with Marcia. Marcia Hawkins will continue again, presented by myhealth-quotes.com on the Sports Byline Broadcast Network.
We are the Debt Destroyer Network. Any debt you have, credit card, tax, student loan debt, call now for free information that helps you destroy your debt. It's great advice. Plus, when you make this free call now, we have Debt Destroyer experts ready to help. They can show you how to destroy your debt and get your life back on track. Debt problems don't have to be overwhelming. You can live stress-free and debt-free. Credit cards, medical bills, IRS tax problems, even student loan debt. Learn about free programs offered by the credit card companies, hospitals, and even the government that can help slash your debt. Call the Debt Destroyer now for free information. Call now. 877-360-0402. 877-360-0402. 877-360-0402. That's 877-360-0402.
I'm going to tell you how you can get real healthcare for as little as $6 a day. Yes, now you can get affordable healthcare for you and your family immediately and save as much as 50% off your current monthly healthcare payments. Our plans are perfect for people that are self-employed, can't afford health benefits where they work, or just want to pay less for their current healthcare. And coverage is guaranteed regardless of your medical condition. We even offer some of the new Christian faith-based health benefits. Save up to 50% on your family's health care. Make a free quick call now. There are no contracts, and we give you a 10-day money-back trial period. Call Provision Enrollment right now for your risk-free, guaranteed health insurance quote starting at $6 a day.
800-472-5145. 800-472-5145. That's 800-472-5145.
Hi, I'm Dr. Robert Clapper, Chief of Orthopedic Surgery at Cedars-Sinai Medical Group in Los Angeles, California. Dedicated to your health, your life, and your sports. As a weekend warrior, you know about sports injuries and pain. Exercise is an important element in keeping your body's core in good shape to minimize sports injuries. But when you are in pain, there is one product that I recommend to my patients, and that is Blue Goo Gel. Blue Goo consists of a proprietary formula developed specifically for the treatment of inflammation and general muscle aches and strains. I recommend Blue Goo for my patients coping with hip and knee pain before surgery, especially bursitis and tendinitis. Give Blue Blue Goo a try. Call 1-888-330-0123 and you'll receive a 1-week supply of Blue Goo absolutely free. The makers of Blue Goo are even paying the shipping. The number again is 1-888-330-0123. If you want more information on Blue Goo, visit online at www.dothegoo.com.
Now available at select Big 5 stores near you.
Elevating with Marcia Hawkins here on the Sports Byline Broadcast Network, Sirius XM 211, TuneIn, also the iHeart Radio app worldwide, and the American Forces Radio Network. Welcome aboard on the weekend edition, myhealth-quotes.com. All right, we'll do the baseball stuff coming up. We'll take a look at football, college football forecast, what's going on with the NFL. 16 NBA players out of the whole rank and file have tested positive. So Commissioner Adam Silver is very much under the gun. We're going to delve into that. But I want to resume that. So you had a professional athlete. That's cool. Because a lot of these guys, especially the XFL guys, the league is gone, but independent contractors, they had no benefits.
Yeah, self-employed people tend to have to, get their own health insurance. And yeah, it can be very difficult. People get very frustrated. The one thing I really want to drive home is people go on the internet, they put out their information, and all of a sudden they are slammed. I don't mean with just a couple of calls. They will get emails, text messages, phone calls until they're literally are screaming at the person on the other end of the phone. But I get it. But what they don't understand is it's not a one size fits all. You simply cannot go on. And I've talked about this before, how people have gone on, purchased what they thought was adequate insurance. Most private plans do not contain the 10 essential benefits that I talked about in our previous segment. They do not cover pre-existing health conditions, and in most cases do not cover prescription drug coverage. There is a couple of plans out there that I highly recommend. The 3-year plans that I talked about in the last segment that are wonderful. We're more of an educator at myhealth-quotes.com. Mm-hmm. We want to educate people so that if they do go on the internet to try to purchase a plan, they understand what they need to look for so that they do not purchase a plan and then find out that when they end up in the hospital that it's not going to cover it. And I will tell you, I see it all day long. Or they buy a plan that they think is comprehensive healthcare coverage, and it's a hospital indemnity plan, which I actually like hospital indemnity plans. A lot of people don't. I actually do for healthy people, young healthy people, and even some people who are middle-aged. It's a great way. You can use it dual purpose. You can either use it to augment a plan a comprehensive plan that you already have to cover your out-of-pocket costs. A lot of these plans have very high deductibles, and it pays a fixed level benefit, but there's no deductible with them as well. So I love hospital indemnity plans, but I don't like it when I, educate a consumer and then find out that what they thought was a comprehensive health insurance plan is a hospital indemnity plan, and they are completely two different products. So, and again, it's better done on a consultation because it's not a one size fits all. But I feel badly when I, speak to somebody and I kind of haphazardly got into health insurance because I've been self-employed my whole life and I didn't understand it. When I understood it, as you know, I love helping people. So if I can help people understand it and, so it's a good fit. But I really want people to understand that there's just, it's not a one size fits all. You really need a licensed agent to guide you. And not all agents practice the same. I will throw that out there. But you want to have an agent that is not looking for you to purchase a plan on the first phone call or inquiry. You want to make sure that you know the plan that you have. I talk to people all day long. They have no idea the name of the plan. Someone just wouldn't let me get off the phone until I purchased it. I have no idea what I bought. I don't know the name of it. They don't know their deductible. Somebody, when they go to myhealth-quotes.com, if they decide to purchase a plan, they're going to know exactly. And I give them my cell phone number. You can reach me 7 days a week to understand more about your plan. And even if you have a plan that you're happy with, I'm happy to go through the benefits summary with them and explain it to them. I love helping people. Health insurance is very, very important. And lastly, I just want to touch on the faith-based health share programs. There's a few out there that are really good. They do work for people. There are some, criteria that you have to meet in order to qualify for those plans, but it's not that difficult if you live a healthy lifestyle. And some of them are non-denominational, so it's not like you have to be Christian, or there's some out there that you could be of any religion to be able to be on their program. And then lastly, there's another program called a guaranteed issue plan, which means there's no health questions. However, for the first year, they do not cover pre-existing health conditions. And in most cases, it has a cap on the benefits that you can receive. So there are options out there for people, but most people just simply do not understand what they're buying when they purchase health insurance. And that's kind of our mission statement, if you will. We want to make sure that people really, really understand it, because after all, while we don't, I can't even tell you how much money I've spent in health insurance over the years, but it is important to have. You need to have health insurance. My daughter fell down a flight of stairs back in July last year, and 2 surgeries, 21 days in the hospital and a rehab facility, and she was in a wheelchair up until Thanksgiving. And we're talking upwards of $100,000 worth of medical bills. Thank God she had insurance. So it's important. You never expect it, but yeah, you need it. And and the funny thing is, I really want to get into this more in our next segment, but we are going to talk a little bit about it right now, is the preventative aspect of it.
Yeah, hang on, because I just want to make one quick point here and get into the preventative side. But you got to read the fine print. And like you said, you give out your cell phone number and you will take calls. I've seen it on the weekends. I'll give you a real quick story. Take 30 seconds. Minor league baseball teams have insurance. They provide health insurance for all their players. There was a clause in there. There was a pandemic clause. Mm-hmm. There was a pandemic clause. Mm-hmm. The owners, 16 franchises, they didn't read the fine print. Guess what? It was right there in black and white. They're left holding the bag. Mm-hmm. It's not that they made a bad decision. They just didn't anticipate it. They didn't read the fine print. And if you do read the fine print and you have questions, you call you.
Exactly. Yeah. Well, that's interesting, because with COVID-19, I would be almost guaranteed that they will be rewriting a lot of the policy regulations when they with everything that's going on. That said, that's why they do short-term plans. That's why it's 3 months or 6 months or 12 months. And, the Obamacare plans, the Affordable Care Act renews every January. That's by design. I have a lot of people that say, well, can't I just buy a policy that'll take me right to Medicare? Yeah, that would be heaven. Yeah. And no, they don't do that specifically because of that. Anytime something comes up that they want to rewrite their brochure and their regulations and all the benefit summaries, they want to be able to modify that to ensure that they stay profitable. So there is a lot to learn about that, but it really does come down to preventative. When you do purchase through the Affordable Care Act, all your preventative care is included in that, and I highly recommend that. But it really comes down to, what we talked about in our last week's program, which is lifestyle choices and being able to not necessarily, for people, who have high blood pressure. I get it. There's some people who have hereditary high blood pressure, and they do need medication. And again, this is not to say you should not take medication. That has nothing to do with it. Right. What it has more to do with the fact is that, if you have high blood pressure and you're 50 pounds overweight, let's start with that. That will make a dramatic effect on your blood pressure, not to mention a host of other issues that you could probably have. For 50 pounds is considered, obese. So it's really important to, to get your weight under control, your habits, not smoking, limit your alcohol. As I said on last week's program, everything in moderation. If people could just adopt a moderate lifestyle where they're, everyone might have a drink on the weekend or whatever, but you really, if you can just tap it back a little bit and really understand the long-term effect that a lot of these choices have on us, it really is important that we take our health seriously, because I tell you, if that all goes and your health is down the tubes, your health insurance, it becomes really, really important, but so does your deductible and your out-of-pocket cost, and you have that every term or every year. So it gets very, very expensive. And we've been blessed with some some, pro athletes, and they're always interesting to talk to. And that's something I want to do on a show down the road, is how we talk about how short-lived some of their careers are and how they end up physically and mentally. And we talked about doing that on another.
Well, professional golfers are independent contractors, and a lot of them they'll because of the PGA Tour, but together they get very little benefits. They have to go out on their own.
Yeah, they do. And a lot of people think that you can just call up a health insurance company and purchase. Privately, you can. But the comprehensive that contain the 10 essential benefits, no, you do have to buy through the exchange. California, Nevada, New Jersey, I believe, and Massachusetts have their own exchange. So you have to purchase through their own exchange. But if you simply just cannot go online and purchase insurance. You can, but buyer beware. You really need to make sure that you fully understand what you're buying, what your benefits are, what your out-of-pocket costs are, and how that plan is going to work for you, your family, and what you're up against with that.
All right, myhealth-quotes.com. Check it out, folks. Very good information. Again, if you have questions, you're going to get her phone number, and she's going to answer them, and we look forward to that. Let's just call the whole damn thing off. Is that what's going to happen in pro and college sports? Is that what's going to happen? There's a lot of theories out there that once sports starts again, it'll get interrupted, and it could be a disaster. We'll delve into that. Elevating with Marcia Hawkins. It continues on the weekend edition, presented by myhealth-quotes.com of the Sports Byline Broadcast Network.
You're listening to the Sports Byline USA Broadcast Network.
Between jobs, retiring, or just need health or life insurance, please visit myhealth-quotes.com or call 833-687-5261. Before you try to get a quote online, call us. We will provide you with the information most sites will not. We teach you exactly what life or health insurance plan you qualify for, how to use your plan, and maximize your benefits. We provide you with the information to make a knowledge-based decision to ensure selecting the right plan. myhealth-quotes.com to schedule an appointment.
From faulty breakers to broken windows to leaky pipes, roofs, and water heaters, homes and businesses around the country can't work until the pros do. That's why Lowe's created credit programs that work for pros. With everyday 5% savings on eligible purchases, plus through October 31st, 60 days promotional financing on your Lowe's business account or extended terms on eligible account receivables. Learn more in-store or online at lowesforpros.com. Putting money back in your pocket. Just one more reason Lowe's is the new home for pros. Subject to credit approval, U.S. only.
Here's a great way to save money on your prescription medications. If you take Viagra or Cialis, we can give you a way to pay as little as $2 a pill. Compare that to prices as high as $60 per tablet. These pills work for men and women to improve their sexual performance. And now for the price of 2 or 3 pills, you can get nearly 100. There's no need to pay expensive prices for Viagra or Cialis. Call now with your prescription and pay as little as $2 a pill. We offer 24/7 service and always free delivery and confidential packaging. Change your life for the better and have fun. Call Pharmacy Shop 24/7 to get generic versions of Viagra or Cialis for as little as $2 a pill, plus free discreet shipping.
800-709-4409. 800-709-4409. 800-709-4409. That's 800-709-4409.
Do you owe $10,000 or more on at least 2 federal student loans? Then you may qualify for new programs offered by the Department of Education. These programs can reduce your interest, lower your payments, and possibly qualify you for loan forgiveness. If you have $10,000 or more and at least 2 federal student loans and currently not in school, you may qualify for one of these programs. Call now to check your eligibility. Student loan advisors are standing by to help you determine if you qualify for these new programs. They can help you reduce your interest, lower your payment, and even forgive a portion of your student loan debt. Take control of your financial future. Make this free 5-minute free call now to Nationwide Student Loans and learn how you can reduce your student loan debt.
800-439-7851, 800-439-7851, 800-439-7851, 800-439-7851.
From the 8, Brady drops back, looks to his right, he pumps, he steps up, he dumps it off Redelman at the 5, on the tackle, he dives to the end zone. Touchdown, Patriots!
Second down, 8. Balls at the 26 of New York. Brady in the gun. Looks into the nickel. Receiver in motion. Shotgun snap. Drops back. Rewinds up. Cracks his own. Goes across. End zone. Over the shoulder. Catch in the back of the end zone. Grabbed by Dorsett. Heavily covered. Touchdown, New England.
Elevating with Marcia Hawkins Sports Byline broadcast. It's the weekend edition brought to you by myhealth-quotes.com. A little tongue-tied here. Oh, man, July 4th. Here it comes. It's a week away, and that means golf, tennis. Hey, we got good news. We want to shout out to Ocean Edge Golf Resort in Brewster, Mass. Some of the guys up and down the Maine Sea coast, they're getting really solid bookings for July 4th. This weekend, the travel going in and off the Bourne and the Sagamore bridges from the mainland onto the Cape and the islands has been great. About time, huh? Pent up demand. You forecasted this. You said this pent up demand would pay off.
Yeah, I really believe that. I do. And I think people are really starting to cement that they have to be careful. Anytime there's a bad flu, I think people should be careful. But yeah, I mean, we definitely are in a realm that we've never been before. And I do think people are taking it seriously. They're wearing their masks. They're washing their hands. They're doing their social distancing. But I also think that people really feel the need to kind of get back to some semblance of normalcy. And I got to admit, I agree with that. Yeah. I think we can be cautious and careful, but I think we can also start to, try to get back to our life again. It's been really an incredible experience. I personally have not felt the effects for a number of reasons, which, I really don't need to get into, but I really haven't missed a beat work-wise. With everything that I do, I have a couple of things that I do. Haven't really missed a beat. My husband hasn't missed a beat. But yeah, I mean, it's definitely a serious virus, but I do believe that we can take precautions and we can get back to it. And I think that you're starting to see. That's why sports are the thaw has started with sports, and I do believe it's going to continue. And we'll have to see what happens.
How would you like to be Commissioner Goodell of the NFL, the head of college football? How would you like?
You really want me to answer that question?
I do. Yeah, I do, because it's a good topic. But how would you like to be Adam Silver, the commissioner of the NBA, playing in a bubble down in Orlando, Florida's new hotspot? Then you've got Gary Bettman, the commissioner of the National Hockey League. I mean, let's kind of get into this here. What would be your mindset? The NFL says they're going to cover the first 5 or 6 rows behind each bench to keep humanity, away from fans. The media is not going to be able to conduct post-game interviews, but via Zoom or satellite. I mean, it's going to be the new normal, and I hate that, but it people can relate to it. But the bottom line is, my fear is these leagues are going to start, Marcia, and you're a huge sports fan. You're going to be bitterly disappointed. I think we're going to get sports interruptus, and I want to be wrong. I want to say that, but this isn't about me. It's about you. Do you think they can get through this and navigate and slalom their way through it?
I think they have to. I think there's just too much on the line. I think that the country as a whole, we really rally behind sports. So yeah, I do believe we are going to get through it. And I do want to say, I do know that there are, the reported spikes in the cases down in Florida and Texas, but it does beg the question. I was down by a department store the other day, and they had the parking lot cordoned off, and they were doing testing there. That recently has started all over the country. So while you are going to get a spike in the cases because of that, more testing. It comes down to more testing, but more people are not dying. I have a wonderful doctor. I just adore him. And I had a very interesting conversation with him, and he really kind of boiled it down. And I'm not going to delve into it for liability reasons, what he told me. But I do believe that the information he gave me, I took it as gospel. I do believe everything he told me, and I practice what he preached, and I don't have it. So yeah, but I do think that, that unfortunately it's the perception of that spike in cases that's got people, going, oh my gosh, what's going on here? We're going to have to lock down again. And I believe Texas has taken some measures to kind of tap down the reopening. So I get it. I think that you bring up the 4th of July, and now I'm beginning to think that maybe that's going to kind of be the tell-all. You're going to have family barbecues. You're going to have people traveling. I have spoken to a few friends that are heading to the Cape for the weekend, for that week. They're going on vacation for the whole week. And I'm curious to see if that's going to kind of be the bellwether to see if we have a huge spike, then perhaps maybe that's going to be the true test of whether or not the sports world is going to take a really hard look at whether or not they can pull these seasons off.
Yeah, Galveston Bay, I know down in Florida, the Keys, up and down the eastern seaboard, the West Coast, up in Oregon, some of the Washington State, Vancouver, a lot of the resorts are reporting very strong numbers. So that pent-up demand is going to be interesting. I don't know. I'd love to see the sports world come off, but I mean, I'm trying to see if I can get you to get your head around what these commissioners playing in a bubble down in Orlando, keeping families away. I don't know. I hope they can pull it off. I know fabled Fenway Park, Sam Kennedy, their CEO, is saying we really want to get fans inside Fenway Park, even if it's just 8,600 fans.
Well, what's the key to running a business, any business? You've got to be able to pivot and adjust no matter what's thrown at you.
Right.
You own a restaurant and your head chef walks out on a Friday night ticked off and you're like, holy cow. I remember that happened actually one restaurant. Really? And the manager of the restaurant, she came out in the chef's outfit and I was like, what are you doing, Bixby?
The show must go on.
The show must go on. And she said it'll be the best darn food you ever ate. And she, you do. So, not to get off topic, but you do have to be able to pivot and adjust. And that's what the commissioners are thinking. Yeah. I drive by restaurants. I drive by numerous businesses, and they've become really creative. And, there's such a demand for sports right now. I really think that they're going to adjust, they're going to integrate it, and they're going to pull it off, whatever that looks like. This isn't going to be forever, but they kind of have to. I mean, we need something, and I just don't see. I'm a little surprised baseball's going to happen. I predicted.
Do you think 60 games is enough though, or do we just need something to get us through the summer? What do you think?
Well, people that love, the foodies, that love to go out, they were happy to pick up their takeout. So I don't want to say we're lowering our standards, but ding dong, we are. I mean, if that's what we have to do, I mean, I would do anything to watch football. I'd do anything to watch the Patriots. As you know, Marty, I will watch sports no matter what. Like, if the Patriots are on a bye week, I put it on at 1:00 and I watch it right up till Sunday Night Football. Yep. I love it. I had Monday Night Football, Thursday Night Football. I can't get enough of it. So yeah, I do believe the fans will come back in droves. It's going to be, it's not going to be easy, but it hasn't been easy on any business. Everybody has had to adjust. And I think there's been some opportunity with all of this. I think that the, doctor visits are going to be more Zoom oriented, which is kind of great. You're not going to be sitting in a waiting room, half an hour. They have to stay on task when they're on Zoom with these meetings. So I think there's a lot of opportunity, and I believe that the sports, they will adjust. They will find opportunity in it, and I think it's all going to be fine.
It's interesting, and I want to profile somebody here and get your comment, because he's an arch rival of yours. But I love when folks, I have not told her I was going to do this, and I want to show you how good she is at doing this. But they're going to have Zoom meetings. The position, like the tight ends, are going to have their meeting. The receivers, the backs, the defensive linemen, the linebackers, and the secondary are all going to have their different meetings by Zoom. It's going to be a three-ring circus. But if it means that we get football this fall, then we're all for it. Ben Roethlisberger, you've long been a Patriot fan. That's been a great rivalry. Came out, admitted his alcoholism, his pornography addiction. It's a heart-wrenching story, but at the same time, I know you have strong opinions and you've been close to addiction in your life. Not that you're an addict. She's not. But you've helped people in recovery. Ben Roethlisberger, what did you do? What was your reaction when you saw that? And he owned it. He's taken ownership.
Oh, I say all the time, you can't fix it till you take responsibility. That's all I needed to hear. Yeah. It's really funny. A lot of times I apply this to anything in my life. If you can take responsibility if you can take responsibility for the good in your life, if he can take responsibility for getting them to the playoffs, then you know what? I'm elated that he took responsibility for it. He can't fix it till he takes responsibility. You can't fix anything in your life until you take responsibility for it. So he's going to be okay. And I am a big Patriots fan. I love Robert Kraft, Bill Belichick, Tom Brady, Julian Edelman. Willie McGinnis. I mean,
but Brady's gone now, by the way.
I know. I'm still. It's a bitter divorce. Don't bring it up. Yeah. But that said, I really, as I told you a few minutes ago, I watch football from the minute it comes on and until it's over. I stay up and watch it to the last game. I follow all the teams. I love to watch the draft. I love it. And I feel bad for Ben. I'm calling him Ben like we're best friends, but if he met me, we'd be best friends. But I'm just really glad that he took responsibility. You just cannot fix something that's wrong in your life. And if you're willing to take responsibility for all the good in your life, you really have to take responsibility for the things that are not so good. So he's going to be fine. That's the first step. And once you do that, you've pivoted and you're on your way back. So kudos to him.
Yeah, it was a big story this week in Pittsburgh, among other things. All right. And the other thing I want to do, and I want to do it in 40 seconds, is a noted talk show host who has appeared on this very network that we're speaking on, Craig Carton, was released from federal prison. You've been a fan of Craig. You've seen his story. We only got about 40 seconds, but a nice, heartwarming story, and a Brooklyn halfway house, possibly some home confinement, and maybe a resumption of a broadcast career. Who knows? Maybe right back here.
Yeah. I mean, good for him. He paid his debt to society. Looks like he's worked a very good program. Again, going back to what I said about Ben, you cannot fix something that you don't take responsibility for. And hey, good for him. Hopefully, he can put his life back together and have an absolute. Rising and be able to come back.
An amazing comeback.
Yep. Exactly. Yeah, I was at a loss for words there for a moment. But I have followed his story, and I do believe that he, took responsibility and paid his debt to society, and now he's back in the saddle.
Yep. He was right here on Sports Byline broadcast before he began that sentence. myhealth-quotes.com with Marcia Hawkins. She's going to come back with some closing comments. And, a little preview of the eve of July 4th weekend. Hannah Campbell from the Balsams Resort in New Hampshire, Mount Washington area, will be Marcia's special guest. And we look forward to that because they're doing some exciting things and more summer tourism right around the corner. So Marcia will do that coming up. But myhealth-quotes.com. So we'll come back with a closing comment from Marcia. And we'll put a wrap on this week's edition of the program. So, myhealth-quotes.com.
We'll be right back.
Yeah, we'll do that. We'll come back right here. Along with Marcia Hawkins, we'll put a close on the program for this week. When we come back on Sirius XM 211, iHeartRadio, TuneIn, the American Forces Radio Network, they are all part of the Sports Byline Broadcast Network.
Roethlisberger first and goal at the 6. 10th play of the drive. Flanked by a back and 3 wide. Shotgun snap, cocks his right arm, throws a pass in the end zone. Leaping, two-handed, falling down, backpedaling catch. Touchdown Brown. Flags thrown. 6-yard strike. He took a wallop, but held on with the leaping, backpedaling, falling down catch in the back of the end zone.
If you or a loved one is suffering from a physical or emotional condition that has left you unable to work, then listen carefully. Take this number down. 800-593-7491. That's 800-593-7491. When you call, you'll speak with a Social Security disability expert and get a free evaluation to see if you may qualify for disability insurance benefits from the U.S. government. That's right, a monthly cash payment paid directly to you from the Social Security Administration. Whether you're applying for the first time or you've already been denied disability benefits, call now. The disability attorneys at Pinnacle Disability can help you build your case, file an appeal, and represent you at no upfront cost to you. Don't wait another minute to see if you may qualify for your Social Security disability benefits. Call Pinnacle Disability Group at 800-593-7491 for your free case evaluation. That's 800-593-7491. 800-593-7491. Call now.
Attention homeowners. Do you have a house that's in need of serious repairs? Do you have tenants that never seem to make their monthly payments? How about code violations, past due taxes, or maintenance costs you just can't afford? Then call my friends right now at Quick Cash Offer. They specialize in buying any home, no matter how ugly the situation. Turn that problem property into cash right now. It's just that simple. One call and you can get rid of that home headache forever. They buy the ugliest houses with instant closings, instant cash, and huge savings. Plus, there are no realtor fees, no listing fees, and no repair costs. Just cash in your hands for that painful property. They're buying a few more houses in your neighborhood this month. So take advantage of this cash offer and call Quick Cash Offer now.
800-426-2301. 800-426-2301. That's 800-426-2301.
Hello and welcome back to the Ronnie Deutsch Tax Program. On the line is Paul from California. Hi, Paul. What's your tax problem today?
Hi, Ronnie. Love your show. Listen, I've got a big problem. You see, my paycheck was garnished last week, and I'm only getting half the normal amount. To make matters worse, the IRS froze my bank account. Listen, I'm embarrassed and scared. I need some help.
Listen, Paul, you don't need to feel embarrassed. You just need some tax help. And the great news is the IRS has some unbelievable programs that can eliminate your tax debt so you don't have to worry about having your paycheck garnished or your bank levied. Doesn't that sound great?
It sure does, Ronnie.
Then do yourself a huge favor and get a free consultation right now and tell them the tax lady sent you.
855-715-5721. 855-715-5721. 855-715-5721. That's 855-715-5721.
All right, down the home stretch we go with Marcia Hawkins, Elevating with Marcia Hawkins, Sports Byline broadcast. Hannah Campbell coming up from the Balsams in New Hampshire next week. And this portion and this entire program is sponsored by myhealth-quotes.com. July 4th, you said it, big bellwether. It really will be a very telling event in this country as the country tries to recover.
Oh, it absolutely will. So I'll be anxious to see, how it fares. And yeah, we've had a spike, but I do believe it's because we're testing more. And yeah, we'll have to see what happens. But yeah, I'm very excited to have Hannah on. It'll be nice to talk to her. She's going to be a wealth of information in terms of how they're doing. So yeah, we'll have to see what happens. New England's been very hard hit. So I think it's going to be very telling how the New England area fares during the 4th of July weekend.
We only got a minute. One more plug. You got a great advertising and marketing concern. Elevated. Could you talk about that? We only got about 40 seconds. Talk about Elevated Media because people are going to start hitting that website.
Yeah, elevatedmediaesquire.com. So it's elevatedmediaesq.com with all of our information there. Our podcasts are actually uploaded onto that site as well. So if you want to do a rebroadcast, you can listen to it there. And yeah, we have a plethora of services that we offer people. Again, health insurance is something I love to do to educate people, but my passion is helping business owners promote their business through a multiple means of communication.
Website one more time.
elevatedmediaesq.com.
elevatedmediaesq.com. 10 seconds. Leave Brady alone. Red Sox baseball going to be happening this year?
Tom, come back. No. Yeah. I mean, baseball's going to go off, but yeah, we'll have to see what happens. But yeah, let's get to 4th of July and we'll take the temperature then.
All right. We'll catch you next week. That's Marcia Hawkins, Elevating with Marcia Hawkins, presented by myhealth-quotes.com, elevatedmediaesq.com, on the Sports Byline Broadcast Network.
You're listening to the Sports Byline USA Broadcast Network.